This is the third video over the skull, so we should be able to complete the main components of the skull in this video. So we'll begin first with the palatine bone. And we looked before at some of this, but this would all be considered part of the maxilla or maxillary bone. But down here at the bottom, this area, this is all palatine bone. Okay, so all of this, also known as your palate or roof of mouth. In addition, we have on the very back of the skull, we talked about how this was the occipital bone. And you'll notice that there is this projection here, this kind of lump, and that is called the external occipital protuberance. We also have near the opening to the ear canal, which is our external acoustic meatus, we have this little lump, which is a process, and that is called the mastoid process. We've got another one on this side. So if we look at it from a side view, hangs down, mastoid process. On the side view of the skull here as well, so we would see this on both sides, there's kind of a faint line that you can really barely see, and on some skulls it's more prominent than others, but this faint line is called the superior temporal line. Superior temporal line. Now again, you're going to have that on both sides. Superior temporal line. Okay, and next, looking at the zygomatic bone. So we did talk about the zygomatic bone in another video, but there are some more components to it. So the main part here, this is zygomatic bone, but we can also know a couple of other things. This area here, that's actually coming up from the temporal bone, this is called the zygomatic process of temporal bone, because it's originating out of the temporal bone. And then over here on the zygomatic bone, where it's growing to connect with the temporal bone, this would be called the temporal process of zygomatic bone, because it's originating off of the zygomatic bone. If we look at the skull from the bottom, you can see that this makes sort of an arch. This is called the zygomatic arch. Okay, and then as we mentioned previously, we have this opening, which is the opening to the ear canal. That is the external acoustic meatus. Coming down from it is a sharp point, and this sharp point is known as the styloid process. So you've got one on both sides. So styloid here, and you've got another styloid here. Styloid process. To me, it looks a bit like a sharp little vampire tooth. Some students actually remember that by remembering vampires are stylish. So just a cute little thing. Styloid sounds like stylish, and they do look a bit like little vampire teeth. Okay, so next in the lineup, we're going back over to where the palatine bone is. And you've got some openings in the palatine bone. These larger openings there and also there, those are the greater palatine foramen. And then underneath, we've got a smaller opening there and also over here, known as the lesser palatine foramen. Okay. And then these little indentations, which are fossa here and also here, those are called the mandibular fossa, and those are where the mandible would attach or set in to those fossa. The jugular foramen is going to be found right here, which is more of a slit. And then also here, jugular foramen. Above the jugular foramen, we've got perfect round circles, and these perfect round circles are called carotid canals. Carotid canals, right above the jugular foramen. Then we have right near the styloid processes, which we talked about before, you can see an opening there, and also one here, and that is called the Stylo Mastoid Foramen because it's near the styloid bone and also the mastoid bone. So Stylo Mastoid Foramen. We then have right near the large opening to the skull, we have a little area called the Hypoglossal Canal, which is a little bit hard to see. So we're going to put a pipe cleaner through here where we'll be able to see it a little bit better. So this opening that you can see the pipe cleaner going through, this is the Hypoglossal Canal. So there would also be one on the other side, right in there. Hypoglossal Canal. Then we've got the Condyloid Fossa. So the Condyloid Fossa is going to be underneath these little bumps. So this bump here is called the occipital condyles. Right below the occipital condyles here and here are the condyloid fossas, or condyloid fossae, if we're talking about two. Then our occipital condyle. On either side of the external occipital protuberance, we have kind of a line going this way and a line going this way. This is called the superior nuchal line. Superior nuchal line. We covered the zygomatic bone already, which is your cheekbones. And then we've got the incisive fossa. So the incisive fossa, this area right here. The medial and lateral pterygoid processes. Here's one, that's medial pterygoid process, medial pterygoid process, lateral pterygoid process, lateral pterygoid process. And finishing up with a few openings, we have the oval-shaped foramen here and also here. Those are called the foramen ovale. Foramen ovale. Right below that is the foramen spinosum, also seen over here. And then we've got, kind of in from those, we have the foramen lacerum. Foramen lacerum. We talked about the carotid canal on either side, and also this large slit under the carotid canal, which is known as the jugular foramen on both sides. And that leaves us with the foramen magnum, which is the largest opening, and this is where, of course, the brainstem would come out and connect with the spinal cord.